Corona is testing our patience. It is testing the limits of all of us. This time, for emerging victorious in this battle, we have to accord priority to expert and scientific advice. Echoed by PM Modi in his recent address to the nation in 23rd edition of Mann Ki Baat 2.0. Today, we stand at a place where we cannot risk our health by neglecting valuable suggestions of experts from the medical field to curb the transmission of SARS CoV-2. Testing, tracking, tracing, isolation and home-based treatment is the most effective solution. India has a total of 2,506 molecular testing laboratories, including RT-PCR, TrueNat, CBNAAT and other platforms. The total daily national testing capacity is close to 15 lakh tests. Till now, a cumulative total of 29,67,75,209 samples have been tested. In light of the current situation, it is imperative to optimize RT-PCR testing and simultaneously increase the access and availability of testing to all citizens of the country. To meet the overwhelming testing demand, Indian Council of Medical Research has issued an advisory for COVID-19 testing during the second wave of the pandemic. Let's get to know more about the recommended measures to optimize RT-PCR testing. It is suggested that RT-PCR test must not be repeated in any individual who is tested positive once, either by rapid antigen test or RT-PCR. No testing is required for COVID-19 recovered individuals at the time of hospital discharge. It should be strictly in accordance with the discharge policy of the Ministry of Health and Family Welfare. According to the Health Ministry's discharge policy, mild, very mild or pre-symptomatic cases admitted to the COVID care facility should undergo regular temperature and pulse oximetry monitoring. The patient can be discharged after 10 days of symptom onset and should have no fever for 3 days. In moderate cases, a patient has to undergo monitoring of body temperature and oxygen saturation. If the fever resolves within 3 days and the patient maintains saturation above 95% for the next 4 days, then he or she could be discharged. In severe cases, discharge criteria will be based on clinical recovery and patients tested once negative by RT-PCR. To reduce the load on laboratories, RT-PCR tests in healthy individuals undertaking interstate domestic travel could be completely removed. Further, mobile testing laboratories are now also available on GEM or Government e-Marketplace portal, and states are encouraged to augment RT-PCR testing through mobile systems. Besides RT-PCR, understanding of rapid antigen test is also very important. Rapid antigen test has a short turnaround time of 15 to 30 minutes. It also offers a huge advantage of quick detection of cases and the opportunity to isolate and treat early for curbing transmission. So far, Indian Council of Medical Research has approved 36 rapid antigen tests and 97 antigen-based rapid test kits have been validated. Besides, the manufacturers intending to market such tests in India must ensure that all material for sample collection, testing and disposal should be part of the kit, and it should also include detailed instructions for usage, interpretation and disposal of the test kit. Now let's have a look at the measures to ramp up testing through rapid antigen test. Rapid antigen tests could be allowed at all available government and private healthcare facilities. To improve the ambit of testing, rapid antigen testing booths could be set up at multiple locations, including healthcare facilities, office, school, colleges and community centers. In order to enhance the access and availability of testing, these booths should be operational on a 24/7 basis. The country's doctors and health workers are waging a colossal battle against COVID-19. The most important factor in preventing the spread of the virus locally is to empower the citizens with the right information and taking precautions as per the instructions directed by our medical experts. We will keep on updating you with more information. Thanks for watching.